Thanks for listening to American Medicine Today. I'm Kimberly Brummel. With us, we have world-renowned orthopedic surgeon Dr. Alfred Bonati of the Bonati Spine Institute. We have Ethan Euchre here. And we have our in-studio guest. I'm proud to introduce Dr. Jason Stibich, and he has a practice in Apollo Beach, and they go over what's called TMS therapy. Now, you know, because I said it to you between the break, what it was called, but why don't you let our listeners know what TMS therapy is and what it stands for?
TMS therapy is transcranial magnetic stimulation therapy, and it's a new way to treat depression in the brain without medications. It's actually using magnetic pulses to the portion of the brain that is the depression center, and the thought process is using magnetic pulses as an electrical stimulus turns on and off the neurons of the brain where the depression centers have been turned off. And so we actually try to turn the brain back on in the area that people suffer from depression.
Tell me a little bit, where exactly you put the electrodes?
The machine is called NeuroStar, and it actually gives a very point-specific magnetic pulse to the left frontal portion of the brain, the dorsolateral prefrontal cortex. And the machine, how we derive certain areas of the brain, we go through the homunculus where we can determine the motor cortex, and the machine puts does some calculations and tells us right where to put the magnetic pulses in the left frontal portion of the brain. So this is a very controlled way to treat the brain instead of the old school technique of electroshock treatment, which is a depolarizing seizure for about 2 minutes that globally gives the brain a seizure and depolarizes it, and that used to be the gold standard of depression.
Yeah, Dr. Stibich, I wanted to actually bring that up because that was one of the first things I thought of when I was reading about this. I'm thinking you're sticking magnets on somebody's forehead and kind of sending a current through their brain. It reminded me of electroshock therapy, even though it's clearly much more modern and much safer, correct?
Yes.
Correct. With the old ECT, you have to go to a hospital. You need an anesthesiologist. They put you to sleep. They depolarize your head with a magnetic current, and you can't remember anything for the next month or so. You come to the office, you lay in a chair, you watch television, and we do this procedure over about 40 minutes, and you're able to go back to work and drive to work, and there's no sedation, there's no side effects to this treatment.
And you're in a better mood too.
Let's clarify a little bit this thing, because what you both just discussed scared the half of the population.
It's not scary, though. I tried it.
That's why I brought it up.
That's exactly because you tried it. Now, are you emotionally unstable right now?
Like she wasn't before? Come on now.
Let me tell you one thing is, let's clarify for the public this. What Dr. Stibich is trying to say is the brain, the part of the brain where the emotions are, where the depression starts, where the problems, emotional problems are located. It's on the left side, on the frontal lobe. And that is the area that is being targeted for control when you use the all procedure. This is the granddaughter of that procedure. Is clean, is properly designed, is incredible target. So without stealing his idea, I just want to tell you, I'm extremely happy that you can give that information to the public, because it's a lot of people who has depression. I think it's around 70 million people or something like that they have depression in the country. But you know something? You have states of depression. You have really acute depressions, and you have minor depressions, mild depressions. If this procedure is something like where that you are saying, you can treat some of these mild depressions and have an incredible good result but also you can treat the bigger depressions and have the same results. So talk us a little bit about that. Tell us a little bit about that.
Yes, the FDA actually approved this device for treatment of severe major depression after failure of one medication. So they've kind of opened it up that say, hey, you fail one medicine, you have depression, you can do this. But, there's other organizations out there that say you have to fail off of 4 drugs, some antipsychotic medications, and that have all of these drugs have serious side effects, and they really the patients come, they're like, I can't remember it. They have sexual dysfunction. My mood. There's so many different things out there that all of these medications, side effect wise, they have black box warnings that, this has no systemic effects to it except for the magnetic pulse tapping on the brain. We can do this treatment on a pregnant patient and have no side effects to the fetus.
It's incredible what you're saying. One of the important things what you're saying is I am a physician who really tried to fight put the patients in medicines. I'm very disgusted how I see in television the tremendous amount of input that the companies of the pharmaceutical companies put in television for advertisement and push people to buy medications that they are really, some of them, very dangerous. And in the depression type of a treatment is horrendous. These people are zombies. And if you need to force the people to be taking 4 treatments and still don't have good results, and then try this one, should be the reverse. This one should be the very initial type of a treatment, so you can capture the people who has a minor problems, and instead to put them in a horrendous medications that they are going to remove your memory, your connection with the world, and your activities, and your work, and being practically sheltered as a depressed people, so even nobody will hire you. So the social responsibility that you are taking here is enormous, but at the same time is fantastic, because if you can use the treatments in the initial stage, then you always can save for individuals that they really need these medications for the later stage. But you cannot reverse that. And that's what's going to be the big fight. They're going to try to put first medications before you treat this one. And I think you are on the right path. We need to treat this one initially to the patients and then use the medications if we fail.
Right. I mean, this treatment's only been out for 6 years and probably nobody's ever heard of it. But the results of this, even after somebody has been treated with 4 medicines, when you're treated with 4 medicines, the probability of going in remission from your depression is about 7% in the STAR-D trial. This Neurostar did their data, and even after people were treated with 4 medicines, we had a 37% remission rate of depression. So we got people with no depression about 30% of the time. We got about 66% to 85% felt better after the treatment. So it's really a remarkable thing. Even if you failed off of all of these drugs, we still have treatment options for you.
Is this typically just one treatment or multiple treatments? And what are the long-term? You just kind of hit upon the long-term results, but do people have to keep coming back, or is it kind of one and done and you're good for a while?
No, that the treatments are over a 4 to 6 week treatment panel for about 40 minutes each time you have to come in. So we do people at noontime in between their work, or in the morning, or even after they get back from work. But you have to do it at least probably for 4 weeks to 6 weeks. But we see people feel difference after the first treatment. They feel like something's been lifted. They might stop. They might sleep better. This treatment is being studied for various different things. Migraine headaches. When we treat people that have depression and migraine headaches, they don't have migraine headaches I have one lady that hadn't had a migraine headache in 6 months. So
Wow.
it's not FDA approved for that, but it's being studied for that. Alzheimer's disease.
Parkinson's, I was reading.
Parkinson's disease.
Stroke, things like. Can you do it to my wife and manipulate her brain so she doesn't want to shop all the time?
That might be a
you do
different
that?
area of
That
the
might
brain.
make her depressed.
Yeah.
It wouldn't.
That could backfire.
It'd make me happy.
Don't worry. Just make more money than that you're psychologically safe.
That's the key.
Yeah.
The more you make, the more you spend, though. That's the problem.
So people can feel better. I treated one lady that she was 70 years old and she was depressed since she was in her teenage years. And after 1 week, she said, "I'm not depressed anymore."
Wow.
And I've seen her back 6 months later, 7 months later, still not depressed. So
And so you're based out of Apollo Beach, right, Dr. Stibich?
That's correct.
And how do people get in touch with you if they're interested in TMS therapy?
we have a Brandon area TMS website. You can call the office, Brandon area primary care. And looking up online, we do TMS treatment in the area, and we'd be more than happy to take any phone calls and consultations.
Very cool.
Yeah, you can reach out to them at 813-645-4068. We really appreciate you being on the program, Dr. Stibich.
I might even give this a try because, I mean, I seem to be rather cheery at times, but I've suffered from depression my whole life. It runs in my family. So might be something I'll check out myself and let you know how I feel afterwards.
And also, I just want to bring up, he talked about different entities trying to say people needed to be on 4 medications before they try this. I think Medicare was part of that. So
one of the things that these types of products that are being on the market today, that they are advanced medicine, they shouldn't be messing with the government.
Correct.
The government is a corrupted, stupid type of a system. So do not work with that. The people can pay, and I'll tell you this, the important thing is if you have good results, the success is there.
Right.
Yeah.
Your mental health and severe depression and family people that want to kill themselves with suicide, we can make them better.
Yeah, all right.
Absolutely. And that's something that probably they should be looking to the poor veterans that they are committing suicides in the country.
For sure.
Correct.
Yeah.
All right. Well, we're up against a break. Kimberly, if people want to get in touch with the Bonati Spine Institute, how do they do so?
well, they can reach out at 855-267-0483 or visit Bonati.com. Thank you for listening to American Medicine Today. After the break, you're going to hear more about what's new in American medicine today. You're listening to News Radio 970, WFLA.